I'm Cara Pavalock D'Amato of Bristol, and this is not deja vu. We are yet here again this year to ask that small businesses have the same opportunity as legislators and state employees to pool together to have lower insurance premiums. Each year, this bill is held hostage and dies because certain legislators have concerns, and with that, they ultimately kill the bill. And even though we've openly addressed all of their concerns and questions, it continues to die. So today, we are here to, number one, show really how this legislation will help small businesses. And we have small businesses with us here to talk about it, but also to ask Senator Lesser and any other legislators who have concerns with this bill to please come to us and to sit down and have a conversation. But again, you don't have to take it from me. I'm here to introduce the head of the Central Connecticut Chamber of Commerce, Katie D'Agostino, to talk further. Thank you.
Thank you, Cara, for having me today. House Bill 5247 represents a significant step forward in ensuring the well-being of our workforce, and it is my privilege to express the Central Connecticut Chambers of Commerce full support for its passage. On behalf of our 1,600 members, one of the questions that we get asked the most is, if we join your chamber, do we have access to health insurance? This is one of the ways that we are able to provide that for our members. The bill is designed to empower employees by allowing them to pool together and negotiate for better health benefits through consortiums. The legislation recognizes the challenges faced by many workers who may not have access to comprehensive health coverage or who are burdened by high premiums and deductibles. By enabling employees to leverage collective bargaining power, we can level the playing field and ensure that everyone has access to quality health care. This bill is not about improving healthcare access, is not only about improving healthcare access, is also about promoting economic fairness and stability. When employees have access to affordable health benefits, they are more productive, healthier, and less likely to face financial hardships due to medical expenses. By allowing businesses to join together in consortiums, we can lower administrative costs and create efficiencies that benefit both employees and employers. This bill provides a framework for employees and employers to come together and tailor health benefit plans that meet their specific needs and preferences, whether it's negotiating for lower premiums, expanding coverage options, or enhancing wellness programs. HB 5247 empowers stakeholders to make decisions that benefit their communities. The Central Connecticut Chambers of Commerce believes HB 527 represents a win-win for employees, employers, and our economy as a whole. By supporting this legislation, we can create a more equitable and sustainable healthcare system that works for everyone. Thank you for your time today, and I'd like to introduce Carrie Carella of Nora Cupcake Company.
Thank you. Good morning, everyone. I'm Carrie Carella of Nora Cupcake Company in Middletown. I opened that in 2011. I also opened Harry's Jailhouse with a longtime employee, Heather Kelly, in 2020, and Al's Ice Cream Shop most recently last year. I opened all of these in Middletown because of its eclectic vibrancy and its relationship with the city and the Middlesex Chamber of Commerce. The ability to pool together with other businesses like mine and share in our risks for healthcare would be a game changer. We would be able to predict our premiums that we would share with other businesses that would result in with our strength in numbers. The ups and downs would be leveled out, meaning when someone has a baby or a medical issue, our premiums wouldn't spike. This is so important that we don't get blindsided with a huge increase in our premiums. And second, in times when our enrolled employees have had less utilization of the healthcare system, we would all reap the benefits by returning those costs back to us. These plans include coverage for items that are particularly important for those in the restaurant and hospitality industry. Birth to 3, coverage for detection and treatment of breast cancer, children covered through the age of 26, colorectal cancer screening, and so much more. I'm proud to support HB 5247 and want all legislators and the governor's office to hear us and support us in our ability to access these health benefits.